Robert is 72. His last blood test came back, and his creatinine was 1.1, right in the normal range. His doctor looked at it, said nothing, sent him home, but there was another number on that same report. His eGFR, 38. 38% kidney function. That is stage 3B chronic kidney disease. And the test that was supposed to catch it didn't. That is what I want to talk about today, because Robert is not a rare case. He is actually the rule, not the exception, for people over 60. I'm Grace Wells. I work with older adults on kidney and metabolic health, and this is Lab Reading, Episode 2. If you were here last week, you know we talked about what eGFR actually means and why most doctors don't spend more than 30 seconds explaining it. If you missed it, it's worth going back. Because today we're going to a deeper layer. We're going to talk about the test your doctor is probably ordering, why it is genuinely misleading for people your age, and what you can ask for instead. Stay with me through the middle of this video, because the part about Cystatin C and how to bring it up with your doctor, that's where things get practical. So, creatinine. This is the number most labs use to evaluate kidney function. Your doctor orders it, the lab runs it, a range comes back, and if your number falls inside that range, most clinicians move on. Here's what they don't explain. Creatinine is a waste product. It comes from the normal breakdown of muscle tissue. Your muscles work, they break down slightly, they release creatinine, and your kidneys filter it out. That's how the test works. It measures how much creatinine is left in your blood. If the kidneys are clearing it well, the level stays low. If the kidneys are struggling, it builds up. Clear enough, right? Now here's the problem. After the age of 60, and this accelerates significantly after 70, most of us lose muscle mass. This is called sarcopenia. It is a completely normal part of aging. And on average, people over 70 have lost between 30 and 40% of the muscle mass they had in their 40s. Think about what that means for the test. Less muscle leads to less creatinine being produced. So even if your kidneys are not filtering well, if your body simply isn't making much creatinine anymore, the level in your blood looks fine, normal range, nothing flagged, doctor says nothing. But the kidneys are still struggling. The test just can't see it because it's measuring the wrong thing for your body at your age. This is not a small quirk. This is a structural flaw in how kidney function is assessed in older adults. And it is why someone like Robert, 72 years old, sarcopenic, eGFR of 38, can walk out of a doctor's office thinking his kidneys are fine. Now, there's a moment in most of these videos where people either lean in or click away. I want to tell you, what I'm about to share has changed how a lot of people in this community talk to their doctors. So stay with me. The test is called Cystatin C, and I want to explain why it's different. Not just that it's better, but why? Cystatin C is a protein your body produces at a remarkably constant rate. And here's the key. It is not affected by muscle mass. Every cell in your body produces it, not just muscle. So whether you're lean or you've lost significant muscle over the years, your Cystatin C production stays stable. That means when your kidneys fail to filter it properly, it builds up. And that buildup shows up on the test clearly, honestly, without the muscle mass illusion. Research in adults over 65 consistently shows that Cystatin C is more accurate than creatinine for detecting early kidney decline. And in some studies, that difference in accuracy reaches 40%. 40%. That is not a marginal improvement. That's the difference between catching a problem early, when you still have options, and catching it late when the options narrow. Normal Cystatin C is generally considered below 1.0 milligrams per liter. Values above that, particularly above 1.2 or 1.3, warrant a serious conversation with your doctor about kidney function. Some labs now offer a combined eGFR calculation that factors in both creatinine and cystatin C together. This is called the CKD-EPI cystatin C equation. If your doctor orders it, that combined number is generally the most accurate picture available right now. I want to pause here for a moment because I know some of you are watching this and thinking, Grace, why didn't my doctor order this already? Why isn't this standard? It's a fair question, and it's not simple. Cystatin C tests cost more than a standard metabolic panel. Insurance coverage varies. Many practices still follow older screening guidelines. And honestly, kidney disease in older adults is chronically underdetected in general. But here's what I've learned working with this community over the years. When patients ask specific, informed questions, things change. Not always immediately, not always easily, but they change. You have more power in that exam room than you've probably been told, and the way you use it is by being specific. So let's talk about exactly what to say. This is the phrasing I recommend. You don't need to memorize it perfectly, but write it down before your next appointment. Doctor, I've been reading about how creatinine can be misleading in older patients, particularly those with lower muscle mass. Would it be possible to also check my cystatin C? I'd like the most complete picture of how my kidneys are actually functioning. That's it. You're not arguing. You're not diagnosing yourself. You're demonstrating that you've done your homework and you want a more complete answer. Most doctors, when a patient is this specific and this calm, will either order the test or give you a concrete reason why they're not, which you can then follow up on. If your doctor dismisses the question without explanation, that is worth noting and worth following up. One more thing I want to say, because I think it matters. Robert's story is not just about a test. It's about the fact that he trusted a number that wasn't telling the full truth. And for 3 years after that appointment, he ate the same things, skipped the follow-ups, didn't adjust anything, because he thought he was fine. He wasn't. By the time his eGFR was reevaluated properly, with cystatin C, it had dropped to 29. That's stage 3B sliding towards stage 4. The difference between 38 and 29 is not just numbers, it's diet changes that could have slowed the decline. It's medications that could have been adjusted. It's conversations that should have happened earlier. I'm not telling you this to frighten you. I'm telling you this because you deserve accurate information about your own body. And because the people in this community, the ones who reach out, the ones who share these videos with someone they love, they're the ones who catch things early. Before I tell you what's coming next week, if any of this raised a question you've been carrying about your own labs, leave it in the comments. I read them, genuinely. And I pull questions directly into future episodes. If your question is good, it's going to help hundreds of other people who have the same one but never asked. Next Monday, we're going to look at Dorothy's lab report. Dorothy is 68. She has type 2 diabetes. Her last panel showed something that her cardiologist flagged, a number that her kidney doctor hadn't mentioned, a number that left unchecked could stop her heart. We'll talk about what it is, what it means, and what every person with diabetes and kidney disease needs to know about it. I'll see you then.